All right. All right. So yeah, if you could fill out that, a bunch of people filling out that poll, if you guys have access to that anonymous survey here, just give me a little bit of a sense of who's showing up here and what kinds of things. Thank you all. I cannot tell you how consoling it was to receive all your emails for your prayers, offering up your prayers, your sacrifices, your masses, your adoration for Catholic Psych and what we're up to. It's really, this is really huge. And it's in the air, right? I mean, what we're doing here is so important because our need in our culture and our society is so important, you know? So on a day when many of us would be down in DC at the March for Life, acknowledging, commemorating, remembering, praying for, sacrificing for this terrible confusion in our culture about human life. We need help. We need to bring together resources, to bring together community, to be able to help people. And it's just been so limited and lacking. So I'm going to get into that. I'm not going to jump ahead of myself. We're still trying to set everything up. All right, Amy Grace, did we resolve that issue? Are we good? I still want to see who's from different countries. I saw Australia, Philippines, Texas. Just kidding. Canada, England, Guatemala. That's awesome. Okay, awesome. YouTube streaming is working. New Jersey, not another country, but Singapore, South Korea, Trinidad and Tobago. Holy cow. Louisiana is a whole nother world. India, South Africa. Anybody in Antarctica? We're wondering if they have internet. Arkansas, Poland. All right. Karen could not submit the survey. I'm not sure why. I see it up still. People are still submitting it. So I don't know. Maybe there's a glitch on your end on the computer or something. Your son's, Teresa, one of your sons is studying psychology. Listen, everybody, just so you know, there will be access to this later. I know some people told me that you had to jump off at some point. Actually, some people are coming in a little bit late. So anyways, here we are. And I am so grateful. I got to figure out how to do the screen share here. Hold on. We got too many Zoom things going on. You'd think by now we'd be an expert at Zoom. We're working on it. All right. Share that screen. And then let me open up a different one here. All right. So hopefully this appears the right way. Amy Grace, that look good? Are we doing the side-by-side thing? If you don't like the way that the screen share is showing up, you can play with it a little bit. You can move the corner or the sidebar of where my video is and where the slides are. So you can resize the size of either one. If you want to see more of the slides, I don't blame you. And if you wanted to see more of my face for some reason, you can change the sizes that way. I've used this format before for teaching, and sometimes people are upset they can't see enough of one or the other. So you have the power now. You have the control. It's in your hands. All right. So back up a second. Title screen. Okay. We all see the title screen. Hopefully we all see the title screen. All right. So the pop-up poll, let's see. We got a bunch of people on there. I think we're going to drop that down now. There will be a chance, I think, at the end to fill that out again, but I want to get rolling here. So got most people popping in through email. Got a nice spread of male, female, young and old. All right. Let's end that for now. And I'm going to close that. All right. Thank you so much for joining me here. I am so excited for you to be here, and I'm a little nervous still, as you can tell. Sometimes I have some nervous energy, but the excitement And the blessing and the consolation from you all supporting what we do is overwhelming. So that's what I'm going to ride on right now. I would love to be able to talk to everybody more deeply and intimately and individually than this format, but this is the best we can do right now. If we have some time at the end, I'm going to open up the question and answer, but most of you have already gotten into the chat, so you can throw out some chat box questions there. And Amy Grace is also with us. She'll be looking at some of those questions. So Amy Grace, if there's any chat box questions that pop up that you feel like are really good, you can actually just shoot those in a text over to me. And because the chat box is like obliterated with all the people chiming in there. So I can't even keep up with that. But you can text me any questions that pop out or stand out, and I will be happy to try to come back around to those things. But at the end, we'll do a little question and answer, and you can raise your hand. I already saw some people popping their hands up here. So, there's been some rumors going around, and people have asked, and I've found out that people are sort of like trying to circumvent and get the inside information on what we're up to here at the Catholic Psych Institute from the boyfriends of roommates, of cousins, of staff members, and some of our therapists and all this stuff. So people are like, what's going on? Is Dr. Greg quitting? Is he closing the Catholic Psych Institute? What's happening? So here's the thing, kind of yes and no. I mean, I'm quitting something. I'm going to tell you all about it. And I want to explain this. I really want to open this up, but it's what I've come to in my discernment of exactly what our culture needs. And I want to really open that up. So let's start with a prayer. First of all, in the name of the Father, Son, Holy Spirit. Amen. Heavenly Father, we come before you, placing ourselves in your presence. Ever present, God, here with us now. Help us to be here with you. We entrust this night to you. We entrust this announcement to you. We entrust the work of Catholic Psych and all of our staff, employees, our therapists, all the work that our patients are doing in working to become the best versions, the saint versions of themselves. We ask for you to pour out your grace in abundance and help us to be open to receive it. And then in all the other work, the other ministries, all those who are here tonight and all of their work, all of their ministry, all of their families, their loved ones, everyone affected by COVID, everyone affected by this unrest in our culture right now, Lord, that you would shine down with peace and joy, that you would give us hearts of peace in a time of turbulence and help us to remember what's most important and help us live for the kingdom that you've told us about, that you've revealed to us. We pray all of this in Jesus' name and in the protection of Our Lady. Amen. In the name of the Father, Son, Holy Spirit. Amen. Okay. So I sent out a survey last week, and I asked if you could change anything about psychotherapy, what would it be? And over 1,200 people responded to this survey. I couldn't believe it. I was blown away. There's like some serious angst and agita and irritation in the separation of faith and psychology and therapy and like trying to get help that we really need. And I found out that there were 3 basic categories of all of these answers in general. I mean, there's a lot of individual answers, but a lot of generalizations. And so the 3 basic categories of answers that I'm going to touch on tonight are that people are concerned about the cost of psychotherapy. People are concerned about access to psychotherapy, and people are concerned about quality, the quality of the therapy. So everyone wants to talk about cost, and I hate talking about money. If I could just be really honest, I wish this whole thing could be free. I wish that we didn't have to, now we're talking about like, government involvement. I'm not going there. I'm not saying politically. I'm just saying I hate having the conversation. No one likes the conversation, but we think about money all the time. Money represents how we value things. And of course, how we value things decides the time and attention that we give to these things. So the thing I'm talking about tonight is actually going to kind of answer these questions of all 3 of those areas. Okay. But you value what you put your time and money and effort and attention into. And that's what shows your value. That's why you're here with me tonight. You value whatever it is that I have to announce. The fact that I'm announcing something and you want to know about it, that means something to you. Hopefully I deliver and give you what you were expecting in terms of value. But this is what's really important. And we have a really deep responsibility to expect good value and know how to talk about these things so that we can move the needle in our life the way that we desire, the way that God made us to desire. So I don't want to talk about money, but I have to talk about money because that's what everybody wants to talk about. So let's make a deal. I'll let you know when we're going to talk about some money stuff, the cost or whatever as a concern. And I'm going to say that, like, please feel free at that point to leave the meeting. Okay. So then it's not a weird, awkward thing. Like, we're going to talk about the announcement, what we're doing and all this stuff. And I will get into the other things that I have an ethical professional responsibility to talk about. And I'm going to get into why that's the problem and why this is such an awkward conversation and how it's been so unfair the way that it's been talked about before. But I'm going to let you know before so that if anybody wants to take off at that point, no problem at all. Okay. But the truth is that most people need some kind of help. And, you know, I think that in 2020, we've really kind of figured that out. You know, the last year brought so much stuff to the surface. So many people are realizing that there are significant issues to work through in our life. And if it's not you, it's definitely somebody that you know. Almost over 90% of people with us right now know somebody that needs help on a professional level from a trusted Catholic source. And so, like, this is the problem. Like, we have a lot of needs and there should be a lot of resources available. I mean, the church has been at this for a long time and science has been at this for a long time. And we've kind of figured out a lot of stuff about being human. So, like, why are these resources not available? That's what I'm going to break into. But first, I want to first introduce myself in case you don't know actually who I am. I'm the director of the CatholicPsych Institute. And before I got here, I was a very confused Catholic. I was trying to figure out how to discern God's will in my life. And, you know, really, isn't that what we're all doing on some level? Like, I mean, especially today in this crazy environment, we recognize the unjust and terrible laws, you know, these issues right now that we're dealing with, that we're recognizing today. There's so much political strife, so much cultural confusion. And so, like, and we seek these answers from social media and we want to go find, like, what am I supposed to do? How am I supposed to think about this? And we're constantly seeking, like, what am I supposed to do? And ultimately we should be asking the question, what does God want me to do? So it's really all about discernment. And discernment is at the heart of what I want to tell you about, because discernment is how I got to this announcement tonight. My story of discernment starts when I was 17. I was suffering from my parents' recent divorce. A lot of you maybe know this story already. This was in my podcast. I'm going to give you, like, the super summary, abbreviated version in case you haven't heard it yet. But at that time, I went to Boston College, and I was introduced to the first time, like, how to really think. And my mind was blown open by my first real mentor, Peter Kreeft. He's a philosophy teacher at Boston College, and he is a Catholic apologist and writes really clearly and powerfully about how to think, really ultimately how to think, but how to understand the faith, how to understand God. He taught me about the faith in ways that I never dreamed possible, and it all made sense to me at that point. From there, I discovered John Paul II, and in his writings, especially in The Love and Responsibility, Theology of the Body, these books opened up for me deep clarity into why I was suffering so much from the distortion of love, you know, from my parents' divorce and from the family breakdown. And JP2 shined this light that it was like freedom. It was clarity. I knew exactly what I was missing, and I knew what was being offered. And so I went after it. I went all in on being Catholic. And my life goal at that point in my life became how to be a saint. I really wanted it passionately, deeply. That's all I cared about from that point forward. I'm not saying I'm always on the right track, but that was my life's goal. Eventually, my discernment took me over to Franciscan University. I transferred out of Boston College. At that point in my immaturity, I needed to get away from that environment to preserve my path to sanctity. And along the way, I was also really thinking about religious life. And so once I graduated from school, I joined the Franciscan Friars of the Renewal in New York City, the CFRs. And this is where discipleship took a whole new meaning for me. And so, I used to have the long beard and the shaved head and the habit. That's actually me in the picture here. And I was, once again, like just completely enamored, totally all in. I just wanted to be a saint. And the beautiful part about this time in my life, I was there for 3.5 years, is when I got to spend a lot of really good quality time with the next mentor who really affected my life, Father Benedict Groeschel. And, between working with Father Benedict Groeschel, who's a sort of famous psychologist, priest, founder of the CFRs, had a show on EWTN for a long time. And many of you probably know who he is, wrote really beautifully about the integration of psychology with the faith. One of the best books. Well, I'll get into that later. We'll answer some questions. But, I was working with him. He was teaching me how to pray. I was actually already interested in psychology. So I was actually learning from him to possibly take over some of the roles of that he had as he was moving closer towards not being able to do as much. And spending 5 hours of prayer a day in the chapel, learning how to pray, learning how to discern, the grace that came through that and healed so many of my wounds that I had still. Even though I was deeply desiring holiness and sanctity, wanting to be a saint, that was my life goal. But I was being pulled back and clouded by so many of these wounds. And I didn't know it. So despite my best intention, I was being sort of handicapped by what was going on internally. But this was the place to do the healing. And so eventually I discovered, as these wounds were healed, that I actually was called to marriage. So I left the Friars before I made final vows, and I went to get my doctorate from the Institute for Psychological Sciences, which is now called Divine Mercy University. It's a school where they integrate really good Catholic theology and philosophy with psychology to produce therapists, psychotherapists, psychologists. And so in 2012, I left with a degree in hand. And that same year, I met my wife and got married. And I moved back to New York City and started the Catholic Psych Institute. So here I am now. I'm the husband of my beautiful wife and father of 5. And actually, number 6 is on the way. We have 6 kids. And actually, when I say that, I mean like literally any minute. My wife is right at the end of her pregnancy. So it's not completely impossible that I'll have to end the meeting quickly and prematurely. She told me like she's going to make me stay in this and do this until the end, no matter what's going on with her, because she's an amazing saint herself. But at least we're on the way. But she is right there. So just a little heads up disclaimer. But part of this like new phase of my life was establishing the Catholic Psych Institute and taking this passion for training in this integration and giving this to others. This is the fundamental root of our model, that we are called to be like Christ. And that means in this modality specifically, like to bring in the sciences, bring in the training, but ultimately we want to be like Christ. For those we work with and communicate God's love to them. That's what Christ does. And facilitate that grace and facilitate that love. And we need this now more than ever. So many people are suffering. And besides COVID and political unrest and all this stuff, cultural confusion, at the heart of all of the suffering today is a total absence of the Father. We don't know who God is. We cast him out, and now we're suffering for it. And okay, that's like the big like, spiritual abstract reason. But there's ways that affects each and every one of us in our own hearts. In some ways, we can't even hear or feel exactly what it is. So what's happening here this need. And in this time period, especially, so many people are discovering ways to that we need to change. And I'm just noticing that my video is really super choppy. So I'm not sure if my audio is coming through. I hope that my audio is coming through right now, but I do see that the video is super choppy. So let me just take a little pause here for a minute. And let's see, gracious. All right. So are we back now? I don't see the chat below. So for some reason, we're not actually, okay, let me just. Texting my wife and maybe she's using my phone. She's going to try to watch this. She's going to play later. I don't know if you can hear that or not, but. All right, I'm back now, I think. All right. So, are we good now? Back to tech issues. We're going back and forth here. So I'm going to try to close some things down here. I don't know if anything else is causing a problem. We have like super fast bandwidth because obviously we are dependent on internet for so much of what we do. But right now, it seems to be causing a little issue. It's totally fine. All right, this is going back and forth. All right, how are we doing right now? Did we kind of pick back up here? Are we clear again? Or are we still out? Okay, well, we're gonna just move ahead here, and then we'll see what happens. Saying sorry, I don't know what you do. Sorry. I'm sorry. Actually, we practiced this and set all this stuff up earlier. So let's see. All right, I'm running off of two different feeds here because of the slides. So we might end up just going off the cuff without the slides if this continues to be a problem. Hang in there with us, everybody, if you're still here. Everybody, still here. That's great. You guys are awesome. You guys are really awesome. So hopefully this is a little bit better right now. It does look like things are kind of slowing down and picking back up again. So I apologize for that. All right, let me move along here in the slides just so that we can keep the show running here. So to give you an overview of the CatholicPsych Institute and basically everything that we are working on, and starting from the beginning, we had the integration as our model in 2012 when training therapists became sort of the full point of everything that we did. And the next step in 2018, I found that I really wanted to do more with online content, with courses, with all of the teaching that we were doing and the resources that we were building. And I wanted to be able to bring people together. So it's not just psychotherapy in this, sort of one modality, but to be able to show much more. All right, people are saying that we're off. So yeah, this something else is going on here. So let's do this. All right, let me do this. We're just going to shut this down. All right, everybody bear with me 1 second. We're going to solve this problem. Kind of. as much as we can. Yeah, it might be the live stream issue. It might be actually the live stream that's causing this. So I'm gonna see what happens here. I'm gonna try to cut this out and see what happens if we can fix this up a little bit. All right, everybody hang in there. If I lose you because I got to switch this over, we're going to come right back here in a minute. I'm still here with you if you can hear me. This is the beautiful thing of technology, and it's also a beautiful thing about spiritual attack. This happens all the time whenever there's something good that we're trying to do. So I'm going to do this a little bit more on the fly here. How about now? Are we without sound still? Can you hear me now? Okay. Now we have sound, and now it sounds like sound is good. See, it's just, we have to just go on the fly here. I don't think it's the microphone, actually. Let me try something real quick, and I'll come back. How about now? Can you hear me now? Is this sound better? This is better. Great. Awesome. So little by little, here we go. Oh, now Amy Grace is telling me there's an echo. I can't do anything about the echo, Amy Grace. I don't know why there's an echo. A lot of people are disagreeing with you. All right. So the only thing that maybe if there's echo, I don't know if there's echo on the live feed. Yep. If you have YouTube up, then maybe then you have an echo. Okay. So now here's the only thing. Now I have to get my slides back up. So sorry, everybody. Now it's just going to take another 4 seconds here. And I'm going to put up my slides. And I don't have my slides to share with you, but I'm going to still follow a little bit of a trajectory here. And we're all good. So all right, I was just describing a little bit of our history here. And so my next attempt is really this desire to bring together all the dimensions of being human. And we need community, and we need resources like good books and courses and things like that. And we need individual leadership and mentorship and that kind of thing through psychotherapy and coaching. So try to bring all this together in the integrated life. And it worked. It was okay. It was definitely a step in the right direction, but something was still missing. And what I realized at this point was that we were trying to do too much to fit into the world of secular acceptance and secular psychotherapy. And there was so much that couldn't be done because we were playing that game and we were trying to fit into that world, you know? So as I've grown in my prayer life, in my professional life, in my business, I reached a point where it's like the stuff was all bubbling. This was like 2 years ago. And I just felt like I didn't want to take it anymore. I couldn't take it anymore. So I was like thinking about this scripture, thinking about Matthew 10, when Christ says, "Behold, I send you out as sheep in the midst of wolves. So be wise as serpents and innocent as doves." And it was like, okay, so we're in this sort of modality, this frame of psychotherapy. And it's like, we are the Catholic therapist and we're going into the world and we're being sent as sheep into the world. And I was almost conflating psychotherapy with being the sheep being sent into the wolf. And all of a sudden it's like the scales fell from my eyes and I was like, wait a minute, it's the psychotherapy. Like, this is the world. There's nothing Catholic about psychotherapy. There's something Catholic about Catholic therapists trying to be Catholic, doing Catholic psychotherapy. Like, yes, definitely. That's a beautiful thing. And I just saw Barbara pop in, who's a Catholic therapist. And she was saying, like, this is resonating with her. Like, this is what happens. We're doing the best we can. 100%. This is not about casting stones and throwing blame on, all people are doing the best we can, but the model is broken. And so what I realized was we don't have to do it this way. But before I jump too deep, I want to like break this open a little bit in terms of like, what do I mean? Like, what's so broken about it? So I'm going to give you 4 simple, if I have my slides here that I can share with you, that might be better than just looking at my face. You can see hopefully both, but let me try to share my screen with. So the spiritual concepts that we believe in as being the most important thing of our life are not allowed. Like, the entire framework itself disallows there to be an actual understanding of our true spiritual dimension. Okay, there's spirituality is allowed. And in fact, there's a division of the APA, American Psychological Association, for the study of psychology of religion. But it's division number 36 out of 54. And here's the thing. You're not allowed to talk about God the way that we actually believe in God. It's one of these things, again, where it's like, I always quote the Princess Bride. It's like, I do not think that word means what you think it means. It's like the word God, the word spirituality doesn't mean what the secular field thinks it means. What we mean when we talk about God is we know who we come from. We know who made us. We know we're made in his image. We're made in the image of God, man and woman. We know that we're made spirit and body. And the body is observable through scientific inquiry. But the higher ordered part of us, the spiritual nature of who we are, is unobservable. It's not reachable by science. Some of its consequences might be that show up in the observable body, but not the spirit itself, which is so fundamental and even higher in the order of what makes us human. And the field certainly doesn't allow us to talk about God as Father and the agent of change. No psychological theory talks about grace and the workings of grace and the Father's love being the thing that actually gives us any hope whatsoever for finding any kind of happiness or change in this world. Okay, the field doesn't let us talk about what we're actually made for, the fact that we're going to heaven. So the second piece here, I'm just going to keep going because I know we lost a little bit of time there, but we'll keep pushing ahead here. And I see a bunch of people chatting in here too, and I definitely want to try to. Now I lost where the chat is because I'm in full screen here, but where's the chat? There we go. So the second part that is really messed up about the field is this framework of diagnostic formulation. Even within the field, even within the secular field, there is pushback and challenging of this diagnostic formulation. And what this does is that this means that we're forced to give a label, a number, a code to whatever it is that you're experiencing. This diagnostic model is medical and it can be helpful, but it's totally misused and ultimately inadequate. And when I say totally misused, I'm telling you, every therapist, Catholic or not, good intentioned or not, is holding this duplicity. And again, this is not to cast blame. This is not to everybody has to deal with this on their own way and within their own conscience. But I got to the point where I can't do this anymore. Everybody knows that if you're seeing somebody and they want to submit for insurance, it doesn't matter if you believe they have a diagnosis or not. You're going to find the diagnosis that you can justify by the typical symptoms that they're presenting with, that actually every single person on the planet could fit into, because there's a code, there's a number, you plug it in the box, and that's how people are going to get money. And I don't want to do this anymore. That's just the tip of the iceberg. That's not the only thing, but it's really not okay. So diagnostics are totally subjective. You ask 5 different trained mental health professionals to formulate a conceptualization of an individual, and you get 5 different numbers and codes and answers. And we identify people by these diagnostic labels, and it misses the reality of the uniqueness and the personal experience of each person, the person's dignity, the complete unrepeatable uniqueness. Now, do we have to have ways to talk about things that are generalizable, symptoms, patterns, sometimes diagnoses? Absolutely. But not the way that it's used right now. All right, the third thing that's wrong with the model is the frame itself of psychotherapy. The session frame is created by insurance companies for insurance companies, specifically so that managed care can monetize your mental health suffering. That's why we do sessions the way we do. There are codes for the certain kinds of sessions that you have to apply for or submit to, and that's why the system works. True accompaniment and healing, the healing work of God, should not be constrained by these secular institutional monetizing limitations. This is a system built to totally support financially these organizations. And we all know it's broken. We all know it. We just accept it because we don't think that there's anything else. There's no other option. This is what's wrong. I'm just on number 3. Here we go. There's 4 I have here for you, right? So we'll go to number 4. Ultimately, this is not real accompaniment. I started out in this field because I want to be like Jesus, and I want to share God's love for people. People shared God's love with me. Peter Kreeft was Jesus to me. Father Benedict Rochelle was Jesus to me. And I vowed and I set out in my life to do that for other people. That's all I care about. That's all I ever wanted to do. And I did what everybody does who thinks that this is the path that they're going to take. And you go to school and you learn the way and you go through all this stuff. And then it's like, oh, okay, this is what we do. It has to be like this. Okay, I guess this is what it has to be like. Okay, so this is okay, fine. We learn this, we learn that. CPT code, what's the code? What's the number? Wait, this person is a number? No, not the person. Okay. No, it's a customer. Oh, the customer's number is, I'm sorry, this person just lost his child, but we're talking about this customer's number. Got it. That's not what Father Benedict Rochelle taught me. But that's where we are, because that's what the field requires. And ultimately, this is not real accompaniment. This is not being like Jesus, walking along the way. So what's this model? What's this frame? You have 45 minutes. You begin your session, you end your session, and that's when you're going to say and hear everything you need to dialogue about whatever it is that you're suffering from. You forget what you wanted to say. You're thinking about things during the week that you want to work on, but that's not when you can work on them. You got to wait for your session. You forget later what you wanted to talk about. You only talk about the things that are in the top of your mind in that session at that time. This is not integrated into the daily flow of your life. This is not accompaniment. This is not encounter. This is not sharing the work of Christ. A lot of times people, it takes a lot of time to warm up. Like, you're talking about these deepest wounds of your life, at least eventually, hopefully you get to that point. And it takes like some warm up, like 20 minutes, maybe 25 minutes to like come into the session. And then what happens? Now you've got 10 minutes to actually talk about it. So you try this, you're doing it, you're doing what you can in this broken model, even if you have the best Catholic therapist in the world, and it feels like it's not worth it. You're supposed to be working on yourself. We talk about self-stewardship, working on things. It doesn't work. Even though you're really trying, you feel like a failure. And then you're second-guessing yourself. You're second-guessing the therapist. You're blaming him. You're blaming yourself. You're blaming her. You're blaming yourself. After doing this for 10 years, I'm questioning now myself. I'm questioning the profession. I'm questioning this work that's being done. I couldn't take it anymore. So I quit. I can't do this anymore. This is what I'm here to tell you about tonight. I can't do this anymore. And I am responsible for so much in the work that we're developing now with our therapists. It's not just me, it's Catholic Psych. It's the CatholicPsych Institute. We have a name, we have a reputation, we have employees. Like, now I'm responsible. I never signed up to be a business owner, but now I'm actually paying paychecks that are feeding 12, 15 other families. There's so much built into this. I can't do this anymore in this duplicitous way. We need something different, and I'm going to do something different. That's what I'm here to tell you about tonight. So I took a little break. I took a little sabbatical, and it was a time for some personal reflection, some deep discernment. And I asked myself this question to help me get back to the roots of what God had called me to do. Somebody's saying they can't see the whole slide. Let me try to fix the window here. Maybe that's the problem. I asked myself this question. What would I have to do to go all in? If I could give someone, like, I'm thinking about like one person. If I'm thinking about actually one patient at a time, if I'm thinking about this one person, this one woman, this one man, what could I give? Like, what could I do? And I let my imagination kind of go wild. I thought about this, like, maybe if I go live with them. And I was talking about this on my podcast. Like, I really was thinking about this. Like, there's like really reality TV shows like this. You're like, you go live with somebody for like a month. Maybe I like sort of set up like a vacation. You come live with me for a month. We do a lot of work in my family. Like, there's a lot of great things happening, just around the dinner table, like, come sit at my dinner table. Let's see what happens. Like, I was really just like free flowing, like just trying to like break out of this frustration of having been told this is how to do it for so long. And then I just open my heart to the Holy Spirit. And I was like, what would you have me do, Lord? And I kept going through all these different ideas. And of course, I'm like, well, but I still run a business and have a family, and I can't go spend a month at somebody's house, and it can't just work with like one person at a time and then, put food on 12 families' tables with that kind of revenue. So like, what are we doing? Praying, discerning, breaking it down. And then it clicked. I was just like, total clarity. Being a daily part of somebody's life would be more effective than anything else that I was doing. And it would be more human, and it would be more Christian. It's more in line with the way Christ accompanies us. That road to Emmaus, Christ is walking with the two men. It's in the context of their life. They were walking. That's what they were doing already. Christ enters in. We were human. That's what we were doing already. Christ entered in to our humanity to be with us, to bring God's love to us, to help us, to carry us to something better. So here we are, and I'm sitting back, and I have my chair, and I set my schedule, and I say, oh, if you want help, you sign up and come to me out of your life, and when it's convenient for me, and this is how I'm going to help you. Well, okay. I mean, I'm saying it with a little bit of sarcasm, but and honestly, again, we're doing the best we can with what we're taught. This is how we're taught to do it. I'm questioning the model, not any individual person here, but the model is not Christian. So what could this look like? I want to do God's work. I want to be like Christ for somebody, for some one person. And be like that in their life, the way that God has spoken to my heart through the people that have mentored me in my life. And this is what it always comes back to for me. I was thinking about this, how many times do we hear it preached in church that church shouldn't be a once a week event? Your relationship with God shouldn't just be for Sundays. Well, if this work I'm setting out to do is supposed to communicate the love of God, and I'm trying to be Christ-like in somebody else's life, how does once a week cut it? It doesn't. So I brainstormed a new way of accompanying people who come to us for help, and I decided to call it Mentorship. Actually, the full title is Integrated Daily Dialogic Mentorship. It's got a fancy title. It's called IDDM for short, and I'm going to break down the title in just a few minutes here. And before I took my sabbatical, I was working with 15 people, and 14 of them decided to take this next step with me, realizing it'd be a bit of an experiment. Full disclosure, they knew what they were getting into, and they took me up on my offer. One of the people was actually coming in for a close anyways, so we just kind of wrapped up, and then the other 14 started with me in this new way. I started practicing with this model, and it was absolutely mind-blowing. Within 3 months, this started last December, so about a year, just over a year ago now. And within 3 months, I could tell that this was something absolutely dramatically different. And I had some patients who made more progress in those 3 months than the previous 3 years of therapy. 3 years of therapy done in 3 months. And, I see some people talking about DBT. Yeah, there's kind of there's a tiny, it's like a fractional element of some of that with DBT, but it's 5% of what we're actually talking about doing here. In order to work with people every day, we had to use technology, change the expectations, change the framework a little bit. And, this was a perfect time for this. I mean, we're all changing frameworks of expectations right now with COVID, for better or for worse, it's making us test our assumptions and try new things. Some of these things are not good. Some of these changes, I'm just I can't wait to get back to the way things were. But I think that many people are discovering really amazing things are possible in the midst of this crisis. And I know a lot of people spending a lot more time with family and, commuting and the work environment. A lot of things are changing, and I think hopefully in many ways are going to be changed for good. Everybody I introduce this idea to had the same exact concerns about this new model being less personal. And I'm going to get into this a little bit more because because we're breaking out of an old framework and there's always resistance, and we come up with all sorts of ideas of why that's not going to work, because we all want it to be the way that we're used to, the way it's always been done. And Deb, that's a great question. You're asking great questions. There's a lot of good questions that my colleagues here are asking. And I definitely want to dig into all that stuff. So there are still boundaries. There's still a framework. We still work on dependence. But here's the thing. What about creating a healthy dependence? What about allowing people's vulnerability to open up, to be tapped into in a way that is actually Christ-like? And in that environment of connecting and actually loving people, exactly, we create a healthy attachment. Healthy attachment, trying to forge healthy attachment that has been broken from the originating family, the school of love, in 45-minute little chunks once a week is quite a proposal. Does it happen? Of course it can happen. Does it happen over lengthy, long periods of time? Absolutely. Is it our duty as professionals to find out if there's more efficient, less invasive ways of helping people, more cost-effective, more time-effective, less emotionally traumatic? Yes, that's our responsibility. The feedback for this has been absolutely overwhelming, working with the people that we've been working with over the last year. And now I've trained the rest of our team. I'm going to get into this, but it's Deborah, $200 a session for psychoanalysis, 3 to 4 times a week. That's the model. That's the closest model that relates to this model. And then we're breaking, and that's still not actually integrated into your life. That's still not integrated into your life. $800 a week, and you're still blocking off chunks of time 4 times a week. We could do better than that. By the end of August, I knew that I had to train everybody else in CPI in this model. The Holy Spirit was loud and clear in my heart, telling me I have an ethical and moral responsibility to train more people to do what I had stumbled into, what God led me into through my frustration, through that discontent. And I had such a range of patients from all different age groups, states in life, levels of distress, all reporting overwhelmingly positive results, from the most normal kinds of things that everybody deals with in terms of distress, anxiety, depression, family conflict, all the way to the other extreme of severe mental illness. And things that I used to work on in the hospital, frustratingly, realizing I'm banging my head against a wall here because I don't know how I'm going to move the needle for this person. And this is without medication, because Christ works. His example works. Imagine that. Applying the example of Christ more to our work makes it work better. Amazing. So let me give you a few examples here. I had somebody, and obviously the names are changed here to protect identity. I'm giving some very basic generalizations of these cases here, and certainly nothing that's identifying. But Bridget had come to me with severe complex trauma, with suicidal depression and debilitating anxiety when we started 3 years ago. And we've done all the things. Like, I'm a psychologist. I'm a trained doctor. I worked 2 years in a hospital. I know all the theories. I know all the models. We use internal family systems. We use DBT. I use mindfulness. We're trained in interpersonal psychodynamic psychotherapy. So we use the relationship. We use the internal objects. We use all the things. And it works a little bit. Over time, people can come out of their distress and move little by little towards happiness. Well, when we started working in this new model in December, in the first 3 months of this new model, she had more progress than she had made in the last 3 years. She figured out these deep unconscious blocks that were keeping her from real peace. She remembered details about her trauma that she had never remembered, and she had tried. And again, doing all the things. She forgave her parents and her abuser for the first time. She felt joy in her life for the first time in 34 years. She felt bad afterwards, and she told me, she's like, I hate to say this. Like, I don't know if I should say this, but 2020 has been the best year of my life. I was like, that's pretty ironic, isn't it? That's what happened. I want to tell you about another one. Robert was married for 37 years, and his daughter had a severe drug addiction, and he had a personality of constantly trying to please everybody. And he kind of valued himself based on how other people thought about him, if he was pleasing them enough or not. And that's how he walked through his life. And he was devastated by all of these, all of these horrible things that were happening as a result of this drug abuse. Well, after 2 years of therapy, he was still enabling his daughter. We were working very hard. He was making incremental changes and incremental progress, but he was still enabling his daughter. His wife left him in that time because she was so fed up. She didn't know what to do. She didn't want to leave him, but she thought that her daughter's life was at risk because of her husband enabling her. So she didn't know what else to do. She left. That's how she set her boundary. And in 6 months of this new model, he discovered how he was creating this old dynamic with his own parents in a way that totally blew his mind open and his heart. He learned how to set boundaries with his daughter, and he reconciled with his wife. So she moved back in. His daughter is now in treatment, and he's maintaining a healthy distance, letting her do what she needs to do on her own with her own treatment team. And now he's working on building back a healthier relationship with his wife. And that's also there are layers and stages, right? So you could imagine, having that kind of, dependency and needing other people to always be happy with you. You're not always going to be sharing some things that you're not happy with. And so now this new phase of his life, this new season, is opening up to a lot of different kinds of communication. And some of it is pretty difficult, but he's working on it because he's discovering his true value. Yeah, Conrad Bars is amazing. He's got a lot of great ideas that fit with a lot of this model. Problem is, people are still working within the regular psychotherapeutic model. He actually tried to test the limits a lot, and he was definitely a forerunner. I am just looking back over some of these questions. Carla says, does anyone not respond positively to the new model, to the new format? There were a couple cases that it was too personal. It was too much. And the first year really was like an experimental year. So we're playing with different ways to do this. And there were some ways that there were different things we learned along the way of like, there are some cases where it might not be the best fit. And so we still, by the way, I should have mentioned this first. We are still maintaining our licenses. I saw somebody else asked about state laws and state limits, and I'm going to get to this too, because access was one of the parts that came up in the survey. And in order to do this, what I've done is actually gotten a legal team together to create a modality where this is totally above board in terms of like all the T's are crossed and I's are dotted. We have a separate LLC. We're operating as under a separate sort of agreement. This is not, what I'm introducing to you is not psychotherapy. It's mentorship. And there's no model for mentorship in psychotherapy. And so there's a lot of very specific criteria for what makes it not psychotherapy. And if anybody's interested later, we can get into the nitty gritty of that stuff. But for now, just so you know, we still have these two parallel offering kind of things. And there are, like, we work a lot with local dioceses. We work a lot with bishops doing assessments and screenings for seminarians. And so there are places where we do want to still have our licenses and operate under that model. It's just not the majority of the things that we're doing. 85% at least of what we're doing should not be under a licensed psychotherapy modality. I'd say easily 85% is better oriented towards a Christ-like accompaniment and mentorship. All right, let me move forward here. I got a lot of questions, a lot of great feedback here, so I definitely want to get to some more conversation, but let me keep moving forward. I had, I think, one more case. Cassandra came to me. She had been fighting an eating disorder for the last 12 years, and she had pretty much beat it, but then she relapsed. And so she came to me when she was in the middle of this relapse. And this was after I already started the new model. So she was looking for traditional psychotherapy. And I had to explain to her, listen, like I switched over, I'm doing this new thing. Now, she had heard about me from word of mouth. She already had my name in her mind. Like, she only wanted to work with me. And she, she was willing to give it a shot. But I also hadn't worked with somebody yet with an eating disorder. And that's a really sticky issue to work with people on. And usually I'll say, like, you need a whole team. You got to have treatment. You have to have a nutritionist. There's a lot of different things here that need to be at play. But I was like, let's try it. Full disclosure again, this is an experimental thing. You're agreeing to do this. And I said, listen, for you to try this with me, we'll do it for a month. And if this is something that you don't feel like is moving you in the right direction, then I will make a space for you to do regular psychotherapy next month. And as long as it's a good fit for you. Otherwise, I'll make sure that we refer you to somebody to give you what you need. And so we got started. And within 2 weeks, she was totally convinced. And she was floored. And she said, this is the most life-changing thing she's ever gone through. In 3 months, she completely revamped her whole sense of self. She totally got through the recurring episode. And more than that, she dug up these unconscious narratives that she had been carrying with her since childhood. And no matter what treatment, she had been hospitalized. She had great therapy. She had done so much already, but hadn't touched any of these unconscious narratives that she was actually carrying with herself. She realized how enmeshed she actually was with her family, even though she had been to family therapy, specifically for enmeshment and codependency. And she found freedom in these. She would engage in these self-sabotaging cycles of sexual promiscuity and acting out. And no matter what she was doing, eating disorder or not, she couldn't stop herself from doing those things. And it was all deeply tied in to these narratives about herself. She completely resolved to relapse, and reasonably seems to have completely resolved her eating disorder entirely. And I followed up with her a little less than a month ago, still completely on the same trajectory. We only worked together for 3 months. And I had never worked with her beforehand. So she started this model fresh, worked on it for 3 months, and did all of this work and had these kinds of outcomes. Yes, I'm training all of our psychologists on this method in the future. That's exactly the plan. We've been practicing it with couples therapy. There's definitely a way to use. In fact, it's actually amazing to work with couples. I can get into that later too if you want. But this is what I discovered. This needs to be shared. This is my new epiphany, and we need to integrate everything in this way and revamp our whole understanding of bringing together the psychological expertise with this work of faith. Somebody asked before, what's the difference between this and spiritual direction? We are still trained in the expertise of the psychological sciences. So we have degrees. We, for the most part, are all licensed to practice psychotherapy. but that's not what we're practicing in mentorship. So we have the training, we have the experience, we have the expertise, and we're bringing it together with the spiritual foundation and the understanding of how to walk with somebody and accompany them in Christ. I'm actually collaborating with Divine Mercy University's Spiritual Direction program. I'm on their advisory panel, and we're talking about ways to bring these things together. So I'm actually going to have our therapists trained as spiritual directors if there's any place where any of them need to be shored up a little bit more in their own training. But obviously, that's something that I've been trained in my life as a friar, and that's something that we naturally do. But the piece that we add is the psychological expertise. We definitely need both. And when we try to deliver what we have with this expertise of science and this expertise of the faith, but we try to bring it through this this secular model, we are completely handicapping ourselves and stripping ourselves of the power of Christ and the grace that he gives us to actually be able to accompany people. It's so mind-blowing, but it's like you have to understand how we got here. Like, again, like you want to be a therapist, you go through the motions. And when you're a student, you're very vulnerable. I was very vulnerable, especially you go to a place that's very well respected. And I'm working with them. I still have the utmost respect for Divine Mercy and IPS. And in many ways, they need to train people to fly under the radar and be licensed and be approved by the APA and all this stuff. What I'm talking about in discernment is I don't have to do that anymore because of what God has allowed us to build Catholic Psych to. And so praise God. That's what he's now calling me to. I'm not saying he's calling everybody to this, but I'm sharing with you why I am doing what I'm doing here, because this is pretty outlandish. It's kind of outside the box, and it definitely can be a little tough to understand what the heck is happening here. I do believe that ultimately we have a responsibility to do this. And I can envision, if I think ahead and I really dream big, creating a certification program, a training, and not just that, but the business structure to make this viable, to make this possible. Instead of limping along, hanging on the coattails of the insurance industry and begging for scraps from the table from managed care. I actually think people value growing in their spiritual and emotional lives. I think that people would take out a loan if they knew that this thing that they can do is helping them become a saint, because that's my goal. So I know there's a big bridge to jump from here to there to say okay, well, you need to be sure that that's actually what you're doing, and it has to be reasonable, and it has to make sense, and it has to be not something that you just keep doing on and on, never really knowing how long you're going to have to keep doing it, which is absurd. And in my mind, totally unethical, and actually how most Catholic therapists and all therapists practice. But that's another point. I'm jumping ahead. Here we are. We've arrived at the third phase of Catholic Psych's development. Our training phase is over. All 12 of us are now equipped to offer this, and we are launching integrated daily dialogic mentorship publicly here and now, Friday, January 2nd, 2021, as we commemorate our terrible political legal situation, realizing that the secular system is very broken, and we are stepping out radically to be able to offer something different that actually brings hope and healing to people who need it the most. So what's so different about this model? The best way to explain the model is to break down its name. It is integrated. This has to do with the understanding of the whole person, reverencing all the dimensions of being human. We are biopsychosocial spiritual beings, and we don't leave any part behind. We recognize that all these parts play together, and it's in the model. Again, it's not enough to just believe that and then practice another model you were taught in grad school that's built on secular foundations. This is the deepest foundation of what we do. especially when it comes to your relationship with God and your spiritual life. You probably believe at least it should be the most important part of your life. We help you figure out how to find life-giving richness in your relationship with God instead of, and this is not talked about enough, the disappointment and the frustration and the guilt that most Catholics actually feel when it comes to the real deep narratives in their life and their relationship with God. Our integration is goal-oriented. This is the one unifying part of mentorship with every single person that we work with. Every single person, our goal is to get people to heaven. And we're going to facilitate that journey for people in however God wants us, for however long, in whatever little way or big way possible. We're made for eternal union with God. As St. Augustine wrote, our hearts are restless until they rest in you. This is why happiness cannot be divorced from holiness. Happiness is holiness. Holiness is happiness. We will suffer constant restlessness until we figure out what's keeping us from God. And it's not just sin. It's these deep narratives about ourselves, our identity, what we believe about ourselves, what we believe about God, what we believe about that relationship. Traditional psychotherapy does not accept this uniform belief in the goal of every human person, nor that we have a creator, nor that our best life comes from acting in accordance with our intended purpose of his creating us. It doesn't address the real reason for our restless hearts. None of the models that come from psychotherapy address these issues. Our mentorship model will help you reorient to your true purpose and facilitate God's grace to get you there. So the technical way this works, this is our model of integration, going to a deeply interior place. And there's a little bit of psychobabble coming up. This will be short, but there's a little bit of a disclaimer there. We focus on your interiority by pointing out patterns of thought, feelings, and behavior that lead to a deeper awareness of the presence of unconscious narratives about yourself, about others, the world, and all of your relationships so that you can move towards your deepest fulfillment. We help people see how their silent personal narratives create blocks on their path to flourishing and contrast those personal narratives to the objective truth about the human person. Traditional psychotherapy, it scratches the surface with these objectives, but without a true foundation, how we're built, we can't understand how to get through this humanity to the goal. It's aimless. And even if you have good solid grounding as a Catholic therapist, this process is severely handicapped when it's attempted once a week. So I see some people commenting on like paying for this. And yes, logotherapy is very close to this as well. Absolutely. What Viktor Frankl does. Here's the thing. If all we needed was spiritual direction, and somebody made the point, like priests get paid for their work even in spiritual direction. So that's totally true. But the psychological sciences, we are human. The reason why you need to pay for this is because you're human. And so the psychology needs to be studied. You need an expertise in the way that your brain actually works. This is what kills me. So many people suffer because you think you just have to pray away your problems. That's not Catholic. Catholics believe in the incarnation, that God became human. And nobody doubts the importance of studying the body when it comes to a physical ailment. But we doubt the importance of studying the body when it comes to a psychological ailment, because we forget that there's an interaction between the body and the spirit. These bodies are not just jails that we shed when we die and we float away free to heaven, getting rid of these dirty body suits. That's Protestant. That's bad theology. That's heresy. Jesus is fully man and fully God. That means that humanity in our very bodies have been redeemed. So what does the spiritual dimension have to do with a professional business? It means that we have to go spend time studying this. We have to go to school. We have to get degrees. I'm not saying that you shouldn't get a degree. I'm just saying you don't have to worry about the APA or who's licensing you by the state. But the education needs to be there. And the business model has to be there. So this is way off track, and we could talk about this later. I told you I didn't want to talk about cost, but when we talk about value, this is something that I feel very passionately about, because people misattribute value to the wrong things all the time. And we're willing to spend $100,000 on an education for a degree that you're not even going to use. And you're willing to spend, hundreds of dollars on a coffee because you like the color of the cup. But then we get back to the things that we actually should value. And then we get like really uncomfortable with like, how much does this cost? Wait, you want what? Why are you asking for this kind of money? Like, really what's going on underneath that is that, and I'm saying this really honestly, like I give free therapy away to people, and I have pro bono, lots of people. I give away my courses. I give away my retreats, virtual retreat out. When I first started, I gave away more stuff for free than I ever charged for, until I looked at the stats, until I looked at how many people that I gave my course away to for free that never finished it. Actually, I looked at how many people did finish it. You know how many people finished it in 3 years who I gave it away for free? 0 people. 0 people. There's a psychological factor at play here, and it has to do with value. And it has to do with the fact that what is money? Money is an exchange of value. If you value something, you'll give some of this stuff for some of that stuff. And if I gave you this thing without you having to show me or put any skin in the game with your own value, you're not going to value it. So I decided with my courses a long time ago, I believe in this course and what you can do with it to change your life. I'm talking about Catholic mindfulness right now. More than, I don't care about numbers, and I don't care about dollars. I don't like all the money that comes in from selling the course goes right back out into developing more resources for people. So like that never, we have the St. Joseph consecration that's out there for free. All this stuff's out there for free, and somebody's got to pay for it. But here's the thing: what you value shows where your heart is and what your narratives are about yourself. And this is what is so hard with psychotherapy or mentorship, or however you want to look at it. Accompaniment. It's like, are you carrying around a narrative that you're not worth it? Because if I validate that narrative and tell you, yeah, working on yourself should cost less than your jeans, then how far are we going to get in actually trying to, move the needle in the way that you think about yourself? All right. So it's integrated. It is daily. Once a week's not going to cut it. It doesn't cut it. It's limping. It's limited. It's handicapped. We provide accompaniment on a daily basis. The model is woven into the real experiences of your life. And this is how we've moved past not compartmentalizing therapy into these 45-minute blocks of time. Instead of all the old ways that the model didn't work before, now this model allows you to speak when you have something to say, listen when you have time to actually reflect and pray, and hold on to things that are helpful. You don't have to put your life on hold to have a dialogue, when in this model, the dialogue actually fits into your life. If you think about it, you have over 10,000 minutes available to you during the week. And the old model of psychotherapy tells you that you have 45 to work with somebody on those. This new model that we've created opens up all 10,000 moments, all 10,000 minutes. And so based on this dialogue that's moving back and forth in the context of each day, you are opening up that possibility to like move with the Spirit as the Spirit's moving you. And that's where the grace interacts with the work. And then this is what we're able to actually do. When we switched over and I started in this model to these daily interactions with a therapist, this made all the difference in the world. And this is a vehicle in this model for developing an actual relationship, very personal, very deep relationships based on an encounter with Christ, and finding in the mentor an expert who can really help you. And so you have this freedom to reach out at any time, day or night. You can leave a message and use that you get a private channel of communication that's opened up with your mentor, and it's there for you to use any time that you actually feel something moving, and that works so much better. One thing that, one way to think about this, when I joined the Friars, my dad had a real hard time with it. And I was talking to Father Glenn Sedano, who's one of the founders of the CFRs. Father Benedict Rochelle was not the only founder. Not a lot of people realize that there were 8 founders. Father Glenn Sedano was one of the founders. And he told my dad had a really hard time with it. And as novices, we're not allowed to talk to family on the phone. And my dad flipped out. He thought that I was joining some cult, and he didn't understand it. He didn't understand religious life. And, it's so, it was like really disorienting for him. And Father Glenn said, well, you can write letters. And my dad was like, what? Write letters? How is that supposed to do anything? And Father Glenn was like, how personal and how deep and how intimate is a letter? When's the last time you received a letter? And my dad remembered, and it was like, 15 years ago. Why did he remember? Because it was deep and intimate and personal. And he said, when you sit down and write a letter, it's intentional, it's purposeful, it's prayerful. And you think about what you're saying, and then you send it, and then it's received, and you receive a letter, and it's somebody else who thought about you and sat down to do that. And now you're reading with that kind of reflection. And it's so much more personal. He said, it's like playing a game of chess instead of a ping pong match. Father Glenn loves these analogies, so he's always throwing them out there, and they're always really good. And so in a lot of ways, this model is more like chess. It's very deep, it's very personal, it's very intimate, and it's so much more effective than the ping pong match of a 45-minute compartmentalized session once a week when you're supposed to fit everything in. It's dialogic, talking about this a little bit more. So there's 2 modes of dialogue. And what's really fascinating is, if you really think about it, so much of our complications in life come from, if you're looking for St. Joseph, don't Google this right now. I want you guys paying attention to, I'm trying to break open this without ruffling too many feathers. So you got to get the whole story. But afterwards, if you want to go to CatholicPsych.com/store, and if you go to CatholicPsych.com, the resources button at the top has a bunch of free stuff in there. So the St. Joseph consecration is in there. I wanted to make sure you got that, even though I do prefer that you're actually getting the whole story here. But anyway, the point is, most complications in life come down to bad communication, and we don't really learn how to dialogue well. And we don't know the skill. We don't learn the skill of not thinking over another person. We certainly learn how to not talk over another person, but we don't learn the skill of not thinking over another person. How many conflicts have you been in your life where you think you're listening, but really in your mind, you're already working through how they're wrong, how you're disproving them, what they don't remember correctly, what you're going to say as soon as they stop talking, you're just waiting, right? Happens to all of us almost all the time. So learning a skill of healthy dialogue where there's 2 roles, there's actually a listening role where you're not just thinking over the other person, you're receiving, you're reflecting on what's being said to you. John Paul II talks about this in Love and Responsibility. He calls it tenderness. This is how we actually build affiliation and closeness in relationships. You can disagree with somebody and still be closer because you know how to actually dialogue with them. And so when we break down the dialogue into the 2 parts and spread it out over time throughout the week, we are forcing a training immediately in how to actually dialogue. And it's so effective. And then in the process, because this is in collaboration with God's grace and the expertise of psychology and the prayer that goes into this process that we all pray for our clients and the work that we're doing, that's where such amazing change can happen. Miracles happen. So it's technically very interesting to see what happens when you record your voice and then you listen to another person's voice recorded. I've had people tell me this about the podcast. Like you put the earbuds in your ear and you're listening to somebody and it's very personal. Well, this is like having that personal dimension, but back and forth. So then you're speaking back to me, I'm receiving this, and whatever it is that you want to say, like speaking from your heart in that space of openness, then that's being shared, and it's back and forth every day. So it's every day. Let me qualify that. It's Monday through Friday where we give responses. I'll get into the technical framework, but I want to be very clear up front. You can open up and talk and share and reflect and record every single day. But there's, the expectation that we set is that we're actually going to respond to you every 24 hours, within 24 hours to your messages, Monday through Friday. So there is a little bit of a boundary there, but it's still, this dialogue is integrated into the normalcy of your life. And that's where this is so effective. Mentorship is where the relationship comes in. This is what's called, in therapy, we have this thing called the power differential. And a lot of people are really nervous around therapists. I get so many people that say to me, are you reading my mind right now? What am I thinking? Or they're really nervous to like do anything or say anything because they think that I'm constantly judging and analyzing them and all this kind of thing. Well, that's because we do profess to have a certain expertise that can help you or your loved ones when in time of need. But that doesn't make us better people. This is where this gets really squirrely for a lot of people. So often I see this differential go to therapist heads, and we forget what we actually owe our clients. And a clear discussion on fees, for example, is one of these things that we owe to clients. An idea of how long therapy actually is going to take. So like we could talk about the cost of therapy all day long, but if you have a therapist that charges $50 a week, or if you have a therapist that costs $500 a week, you might be like, well, clearly the $50 one costs less, unless you're in therapy for 3 years with the therapist who charges $50. At that point, you're talking about $7,500. That's actually what you're paying. So it's not ethical to use this psychology of small numbers and small, increments to show like, well, we charge less. Okay, well, how long am I going to be in therapy? Well, there's no real way to tell. We really can't say. We're going to have to, see how it goes. That's something that we need to work on. We need to change that. And that's something that we're working on right now. All right. The expertise, by the way, is necessary. The power differential is necessary. It's because of this expertise that mentorship can provide a corrective relationship so that you can overcome those mindset hurdles based on the misperceptions of self. The frequency of interaction, the vulnerability of that spoken word revisited every day, the experience of sharing one's life in real time with somebody leads to a deeply personal relationship with the mentor. And this is the seedbed of powerful grace to help heal wounds that are often the result of misguided and wounded relationships in the first place. Mentor relationships are deeply personal. And, sometimes they feel more supportive. Sometimes they feel more challenging. But it's dependent on the needs of the person that we're working with. It's completely oriented towards the other. Ultimately, these relationships help a person to understand their own relational dynamics, how they're in relationship with the other. And then that can apply to the ultimate relationship, which is, of course, with God. So there it is. That's our new model in a nutshell. This is what I quit psychotherapy to develop and bring to you and bring to the world. This is the missing key to really incredible change. And this model, facilitating God's grace, opens the door to miraculous transformation. And this is what I also realized. There are really 3 parts to something being incredibly effective and being life-changing. First of all, you need to find somebody that you trust. That's obviously very important. Second, and this is frankly not talked about enough, but you have to actually have the motivation to change. You need to want something different for yourself. A lot of people come to therapy and they're like, all right, fix me. And they're expecting the therapist to do all the work. Now, if you're only working on the body, you could go to the doctor and you could say, all right, doctor, knock me out, open me up, operate, close me back up and let me go home. That's the medical model. And that's a flawed thinking when we bring that into social, emotional, psychological, and spiritual health. We need to participate in that because of free will, because of the dignity of the human person. So you need to have a person you trust. You have to have your own motivation and reason to change. And then there's the third element. So many people think that that's enough just to have those first two, and you end up spinning your wheels in therapy. Doesn't matter if it's $5 a week. You're spinning your wheels in therapy for years because you don't have the third element, and you get disillusioned. I think that that's part of why psychotherapy has such a tough reputation. You know, there's such a stigma to going to therapy. I think because for a lot of people, it doesn't work. And then we're all supposed to ignore that and just come up with all the excuses why. Well, they weren't ready, or, you know, this or that, whatever. But what if maybe it's not your fault that it's not working? When you bring the reason to change, even if you find the right person, maybe there's another way that we're supposed to facilitate that change happening. And here is, in my estimation, the missing piece. It's this model. It's the model. That's what's missing. So let's talk about what we're using it for, who it's not for, who's a good fit. You know, it works for issues in family life. We've worked with people with marriage issues, parenting issues, dating. We have dating, people who are dating or single and sort of thinking about things like that. Vocationally, more than just dating, you know, people who are struggling in their vocation. We work with priests. I see a question about how the bishop responded. I'm not sure if that's directed at me or somebody else in the comments, but I've introduced this to 3 bishops right now, and we're working with all their priests. They love it. They absolutely love it. They recognize that the old model is broken. They have to check the box and take care of their priests, and their hands are tied. They definitely don't know what to do. And so, you know, bishops are definitely on board, and we're doing a lot of great work with the priests that we're working with here. Addictions, people who are suffering from addictions, we're really uncovering. People don't talk about trauma enough with addictions. And so, yes, there's behavioral stuff that we need to work on, and accountability. It's like the SA model or the AA model or the NA model. You have a sponsor, not somebody who's particularly well trained, but just the fact that you have that accompaniment is life-changing. That's one of the fundamental pieces of the entire AA model. So imagine having the accompaniment of that accountability with the expertise and the spiritual dimension. That's how this thing is exploding. And of course, addictions are not a problem. We're taking care of addictions. We're taking care of, it's really the deeper issues. The addictions are the symptoms, but we're taking care of the deeper issues that are leading to the addictions. And then a lot of other mental health issues. We've worked on a number of, like I said, severe mental illness cases, anxiety, depression. Somebody mentioned before, like schizophrenia and what was the other question you asked about? Schizophrenia and bipolar. They're totally different, but you know, schizophrenia, we would always want to have medication involvement anyways, for the most part anyway. So in terms of anything that a psychotherapist could do, those issues will be worked on even better in mentorship. And like I said, there have been a couple of cases out of 200. I've had maybe, I'd say between all 12 of us, there's less than 5 cases that for whatever reason, the model's just not developed enough yet. We haven't done it enough, where like 5 cases, we were like, all right, let's go back to psychotherapy with this person, because that's what we know. And for those reasons, you know, in those cases, there was some stuff that came up there, and you know, we needed to dig into that a little bit more. But that's 5 out of 200, so 2.5%. So if you know, if you're one of the 195 or somebody that you know, by the way, you know, this is really important. I recognize a lot of you here tonight are supporting me, CPI. You have your own ministries. There's a lot of other reasons that you're here. So this isn't just about if you're struggling with something that you need to work on. I think we all know people that could really use some kind of help. And learning how to talk about these things in a way that opens the door to engage their will is one of the most important things. So how would it not be a good fit? Well, remember, we talked about trusting me, having the motivation, and understanding the model. So maybe you're not sure if you have the motivation yet. Maybe you want to start working on things a little bit slower, some more piecemeal kinds of things. Maybe you're just not ready. That's okay. We have things that we have available for people that are much smaller in scope, certain courses, the virtual retreat. Maybe you actually don't know enough about me yet. Maybe, I don't expect you to just trust me without knowing me or anything about me. So we do have what I've put out there called the virtual retreat, which is an 8-week daily reflection series. And it'll introduce you to the way that I conceptualize integration and how to bring together the faith with the way that our brains work. And that's a good place to start. I wouldn't start in mentorship if you don't already have that trust built up. And then if you're cautious because of the model, by the way, all those things that I just mentioned, the St. Joseph consecration, which I mentioned before, all of that can be found at CatholicPsych.com/store. So you can go check that out later if you want to check out one of those other things. If you're cautious because of the model, welcome to the club. A lot of people are cautious about this model. And what I've decided to do is to put my money where my mouth is, and, to put the business model on the line with the new model that we've developed. And so what I've decided to do is actually create a guarantee. Now, I need to pause here for a minute because this is going to sound a little bit out there. You've probably never had a therapist who told you they would give you your money back if you don't like the therapy. Okay, but I am going to do that. This is not therapy. This is mentorship. But I am building in a guarantee that will allow you, because this is brand new. And here's the thing. This is it. It's the mentorship model promise. And the way we see this, the way I see this is a model of accompaniment. And that means we share your burdens with you. And one of the burdens right off the bat is the perceived risk of trying something completely new. Use this model for 2 weeks. And if you aren't convinced that having us available for you as a mentor is going to change your life in a radical way and move the needle in all the ways that you're trying to come to us for help, then we'll give you a full refund, no questions asked, no problem. You're definitely not going to find that anywhere else. But I don't know anybody else that created something new and is trying to convince people that it actually works. So I'm going to share part of that burden of proving that this is actually doing what I'm saying it's doing. So the way this works is you sign up for a month. We do 1 month at a time, and it's working every day for a month. The amount of work that you can do, I'm telling you right now, is exponential beyond what regular therapy can do. But you'll have the first 2 weeks of the month up until the 14th day to completely pull the plug on the whole thing, get your money back, no questions asked. So with this mentorship promise, we are going to give you those 2 weeks. You have a chance to try it out, see if it's for you. And if you don't agree that this is what I'm saying that it is, then happy to give you your money back. There's literally no risk to getting started and trying this out. All right. So this is the point in the presentation where I am going to give everybody who's still here. I don't see a number here. How many people are still here? Wow, we have like almost everybody still here. Okay, well, here's the point in the presentation where I'm going to get into talking about stuff that's uncomfortable for everybody. And if you just wanted to find out what we're up to here at CPI, I am so grateful for you. And I'm so grateful for your support. And please pray for us. Please pray for everything that we're doing. And, follow up with all the questions you want. Dr. Greg at CatholicPsych.com is my email address. Hit us up through the website. And totally feel free to close it up for the night. And we're also like way over time here because of the tech issue that we had there. But anyways, point being, if you're going to stick with me here, then can I have your permission to talk about something uncomfortable, getting into cost and telling you what the actual offer is? I know some people are waiting for this anyways, but There's a lot of people not. So that's you know, I just want to be respectful to everybody as much as I can out of 400 people. All right. So when it comes to, these are the three areas of concern that people brought up. And so cost is one of the biggest ones. And I changed the model to be the most effective possible, because whatever the cost is today, that's nothing compared to paying that cost over and over and over and over and over again for month and month and month on end, without knowing how long this is actually going to go on. Like I said, if you thought this is actually going to heal your marriage, heal your relationship with your kids, resolve your depression, help you sleep at night, resolve your anxiety, I would absolutely believe that you would beg, borrow, and not steal, but get a loan to do those kinds of things in your life. So it's not about the number, it's about the value and whether you believe that this is actually possible, and is it the best way possible to get the thing that you believe you can actually get. The work that takes 12 months in the old model takes 3 months in our model. 4 months of therapy can be done in 1 month of mentorship. Easy. We see that over and over again. Like I said, we have almost 200 people receiving mentorship right now. Like, this works better. And so since it works better, it takes less time. So it costs less. So even if we kept 1 month of mentorship at the same cost as 4 months of therapy, think about this for a minute. If you had to pay 4 months of therapy, but you could do the same amount of work in 1 month, would that be worth it to you? You're doing the same work. Like, if you knew that was the case, if you believed in this model and you thought that you could make the same progress and do the same amount of work, what are those extra 3 months of freedom from the thing that you are working on worth to you? I would gladly spend the same amount of money for something taking a shorter amount of time than if it took a longer amount of time. That doesn't make any sense. So a month of mentorship, it does cost a little bit more than a typical therapy cost throughout the month, but we're definitely not charging 4 times as much as what therapy normally costs. And I'm gonna break open cost a little bit more, but I want to touch on these other 2 points from this slide. In terms of access, this is another question somebody was asking about, because we're in a really weird situation right now. With COVID, every state has a state of emergency declaration, and every governor has established certain rules about what that means for them. And so state by state, everybody's confused. Nobody knows what's available, what's not available. Where can you work? Can you go across state lines? What about your license? What about this? What about that? Access is a major concern for a lot of people. And we work with people in India. We work with people in Abu Dhabi and Dubai, the UAE, and a lot of places in rural United States, and places where the state might not allow for the kind of therapy. And this is a major concern. And as we grow, we have to be more concerned about this as well. So I don't want to do things illegally and then put everybody in jeopardy. So here's what we want to do in creating this model. We've just basically stepped entirely outside of the field. We're completely outside the box. Like I said before, we have a legal team. They research this. They set the whole thing up. We have a separate LLC. We have separate employment agreements. The therapists are not acting as therapists, but mentors. This is like a second job for our staff. We have 2 companies, 2 staffs. This is like the way that they're doing it. And in fact, there's another model where we got this from. We have friends in the military, and the military actually provides a very similar service to their to people in the Army and people who are suffering, to their soldiers and their families. And it's called family life coaching or family life consultation, something like that. But it's completely outside the scope of regulated psychotherapy. So the license doesn't matter. The state law doesn't matter. There is no state law to regulate mentorship. because we just made it up. And we have very specific reasons why this is not psychotherapy. So anyways, the access is going to be there, whether the states of emergency close or not. All right. And then quality was the third thing. Quality, people are saying, like, it seems like you have to either sacrifice the Catholic part or the professional part. And a lot of Catholic therapists, people have told me, are not providing professional therapy. And a lot of therapists that they might find professional therapy are not consistent with their Catholic worldview. Now, I know a lot of great Catholic therapists, so I know that that's not true across the board by any means, but we take that very seriously. And so we've deeply implemented training into our program to go very deep into the human person, anthropology, clinical application of the anthropology. And this is how we're developing a model that you can trust. And like I said, it just takes some time to try it out, and again, bringing something new to the world. I understand that there's a perceived risk involved, so that's why we're putting in the guarantee there. But at the end of the day, we're providing quality work in a way that hopefully provides better access and is in a way more manageable and understandable as a cost. All right, so if you feel ready now, the program is by invitation once you fill out an application. I'm going to open up the application here in a minute. And so that process will be available to you. And just for right now, like, the whole point of this tonight was a town hall. I was just giving an announcement about what we're doing at CPI. So the point of this wasn't necessarily to, like, get a bunch of people to sign up for it. But if you do feel like you want to sign up, we do have a certain limited number of spots available. And so we have 12 therapists, and between all the people that they have spots for, I think last time I checked, I don't want to mess anything up here, but we had just under 30 people had spots open. We had spots for just under 30 people last time I checked. And so what we want to be able to do here is at least open up the process for application if you are interested. And then, the thing is too, like I said, if you're listening to this and you're thinking about this for somebody else that you feel like could get to therapy, I want to give you a way to talk about the cost in this model and what we're doing that will take away a little bit of, the sticker shock from looking at doing something monthly instead of weekly. Like, I can't drive that point home enough. It is a marketing tactic that is unethical to give somebody a lower number, even though you're not actually telling what the bigger number is. So how do you get people to think about taking this step and really present this in a way? This is one of the most frequent questions I get emailed every week. People ask me this. My aunt, sister, cousin, piano teacher, gardener really needs some help, but doesn't think it's a big deal. They definitely don't think it's worth the cost. There's no way I can get them to start. How do I talk to them about this? So let me break this down and talk about this a little bit more. First of all, I found that people judge the cost of therapy based on the fee for a weekly session. And this is the unprofessional thing. But there's no way to tell in the old model. And again, remember, the insurance companies created this model. They don't care. They don't care. They like having people signed up, and they're not giving you reimbursement fully anyways. So they'll give you your $30 or whatever it is endlessly because you're tied into the system. And the way they make billions and billions of dollars is by getting people to stay tied into the system. But, you hear the regular number for weekly therapy. It's $150 or $200 maybe per week. And you decide if that sounds reasonable for you without realizing that you're not making a decision with enough information. And that's what's really unfair about this. So most clients end up spending 6 months to a year in therapy. Let's say the average cost is $150 a week. So you're not making a $150 decision. You're making a $5,000 decision. And again, what if you could do the same amount of therapeutic work in just a month or two? Think about it. You're dialoguing back and forth 5 times a week. Of course, you're going to do much better work, much more efficiently. It's going to get done a lot faster. So you stay on track in this model. There's not this awkward stopping and starting, trying to get back to where we were before. And like I said, I've seen 3 years of therapy accomplished in 3 months. So, now that's not the norm. I'm not going to say that's the norm, but it's certainly reasonable to expect 4 or 5 months of therapy to be accomplished in 1 month. Okay. So if people are typically charging, if that amount of therapy normally costs $5,000 and you could accomplish that goal in 1 month, wouldn't it be worth paying $5,000 to accomplish the same goal? And I know a lot of people are saying like, well, I don't have $5,000. I get it. Some people don't have $5,000. I'm not saying everybody needs to have $5,000 that you should. I'm saying we're talking about value right now. How to think about this, because the person you're thinking about possibly going to therapy, and that's exactly like, you need to change the way you think about the value before you actually start trying to get them in. Because if we're not valuing correctly, we're not going to get in. So that total amount, if this is what we're working on, this is what we're moving, you're healing your marriage. Like literally, if somebody said to you, you're in marital distress, would you pay $5,000 to heal your marriage? Would you? Would you pay $5,000 to reconcile with your son? I don't know. And then you're like, well, I don't have $5,000. Well, okay. Would you? But that's what it costs. If it costs $5,000 to heal your marriage, I have a way to actually help you heal your marriage. And it's your choice. Like, you can take it or leave it. I'm not saying you have to do it. I'm just asking you, would it be worth it to you if you thought that it would actually work? What do you value the things that you need to work on in your life? Would you pay $5,000 to heal your marriage? It's that simple. So in this model, you're getting all of these things that we've been talking about, and we're going to work with you as quickly and efficiently as possible and prove it by offering you this guarantee so that you actually get a full refund if you find out that this is not what you thought it was and it's not working the way you thought it was. So I know people are getting upset because I haven't talked about the number yet. I'm trying to prove the point that it's more important to talk about the value, but all right, I'll get down to it. It doesn't cost $5,000. When we launch this program fully, it's going to cost, we're going to have tiers set up. We're going to charge, depending on the experience of the person you're working with, we're going to have apprentices who are learning the program, and then they're going to have graduated into a master mentor level, and then we're going to have training directors who also have that, especially that spiritual dimension already sort of trained. And so we're going to have these 3 tiers. It's not going to be $5,000. It's going to be $1,500 or $2,000 or $2,500 at the top tier to work with one of our training directors. Okay, but since we're just launching this program, and this is, I really only have a few spots left. Like, as soon as these spots are filled up, we have to just turn this whole thing off. But since I'm just launching this right now, even with the guarantee that you can get your refund back or whatever, we're going to open this up for right now for anybody that's hanging in with me right now. Let me just see how many people are at. Okay, so we have a bunch of people still hanging in there, but you can get started right now for $997. $997, and that will get you into the same exact program with the same exact people who are going to help you with this mentorship, working with you every single day, right where you need it, right when you need it. And this is what is transforming the way that we can do this work. And you can experience that for yourself right now. You still need to fill out the application. So the link, I don't think we actually have a link. Do we have the link yet posted? Do we have the link posted? I don't think that's actually posted anywhere. So, okay. So to fill out the application, you go to CatholicPsych.com/mentorship. And so you fill out that application on that page, and then we're going to review the applications that we get. And then we'll send you an invitation. If it seems like we ask some questions in there to parse out some of the stuff that I was mentioning before. And if that's a good fit, then we'll invite you in to get started with us in the program for the next month for February. So, the other thing about this is, I was saying, like, I was brainstorming in that time, like, how can I actually give everything that I have to give possibly? Like, and I realized I have so many of these resources that I've written, developed, that I teach. I have all this stuff online, And the integrated life community is where we hold all of those things. So when I was thinking about like the one person that I really want to help, that I really want to work with, and if I could give them everything that I have to give, I would give them all those things as well. So we've included the integrated life membership, built it into the actual mentorship program. So as long as you are working with us in the mentorship program, you have total free access to all of my resources online, my courses, my books, the virtual retreat, the exercises, the workshops. We do a live call every week. And in the integrated life, it's called Integrated Live, and you'll be a part of that. And then something I decided to throw in right now, just again, because you're hanging with me till the end of this presentation. So if you're hearing this because you're actually here with me still, even if you decide to cut out, or if you finish up whatever you need to work on in the mentorship program, if you don't, even if you refund it, if you get started and then refund it and you get your money back, I'll still give you a full year of membership to the integrated life. So don't worry about that. You'll get that access no matter what. But that's the place where you'll be able to see a lot of the resources that we have available. Okay, so there's the cost. Here, oh yeah, here's the mentorship model promise again. So just to remind you, you have 2 weeks to try it out, and then if you don't like it, you don't like it, and that's all. So I was hoping we'd have more time than this for some question and answers. But I still want to answer questions. So how are we going to do this here? Let's see. I have attendees, and I can pick on you to allow you to talk. And I think it should send you an invitation to turn on your microphone. So Regina, I just said talking permitted. Can you hear me? You're still muted. So Regina, you raised your hand. I chose you. I permitted you to speak. That's what Zoom says. And I am on mute maybe. No, I'm not. Can you hear me?
Yes,
Regina?
can you hear me? Can you hear me?
There we are. Okay.
Thank you so much. I just well, first of all, I missed the part because my daughter was fussing. It's $9.97 a month each month, right?
Yep, that's right. It's $9.97 for the month.
For each month, okay. And do you have to pay that all up front?
Yeah, it's an upfront. Yeah, you pay for the month up front. You don't have to. You're not committing to any number of months, so it's up to you to decide whether you continue on to another month.
Okay, great. I actually and had a question for my daughter. My daughter has an eating disorder, and she actually goes to Franciscan University. She's a psych major, and she's working with a nutritionist right now. And so I was wondering, could she work a tour alongside of them, or would it, so it's sort of like an extra, to add the spirituality to what she's already working, or would it be in place of, do you think?
I'm sorry, you said she's working with a nutritionist?
And a eating disorder therapist.
And a therapist. Well, that's kind of the nice thing about this model, is that normally you wouldn't have two psychotherapists working together or working sort of separately from each other. But we're not operating as psychotherapists here. This model is mentorship. So we actually do work with people who are also in therapy. And
awesome.
It's a place to process what's happening in therapy in a way that is, it's just more spiritually oriented. And so if it's somebody who's consistent with the faith, then that's amazing. And if it's somebody who's antagonistic to the faith, there might be some benefit in certain circumstances, like with something severe like you're describing. And it might be like a specialist in nutrition or whatever. And then we have a place to process even further, like, okay, what do we take? What do we leave behind? What's going to work? What's consistent? What's not? So yeah, we're totally open to that.
And is there like a particular person you would recommend for eating disorders?
If once we start the application process, like we do have that as part of the process. So yeah, we do have a couple of people that have worked with it.
My question really was, do you have somebody specific? And
we have a few people that have worked with eating disorders regularly.
Okay, great. Okay, thank you so much. I appreciate your help.
All right, sure thing. Thank you. God bless you.
Thank you. You too. Bye-bye.
All right. Let me see here. All right. Whitley, are you with us, Whitley? Let me hit your button here. The buttons keep moving because everybody keeps jumping in, raising their hands. Okay, Whitley.
Oh, can y'all hear me?
I can hear you.
Okay. Sorry, I'm putting my kids to bed. But so I guess my question comes more as like, sorry, my kids ended up being a hold on, I'll be right back, buddy. A patient.
No problem. I came down to the wire myself with our kids. I was expecting one of them to pop in here.
Yeah. Well, so for me, like I've spent the last year with PTSD, OCD, going through ERP, and then moving to the radically open dialectical behavioral therapy, and now I'm in EMDR. And for me, one of my big problems became my obsession with the relationship with my therapist. So, like, how would you go about dealing with, like, it became a compulsion, the texting. Like, whenever anxiety would come up and issues would happen, I would text out of compulsion. So like, how would you deal with an OCD client that's struggling with those issues?
Yeah, absolutely. That's a great question. And the fact is that we set boundaries according to what's actually good for the person. And so there's a lot of flexibility in this model with the structure, but there is a structure, and it's very intentional and it's very professional. So that I actually just had this situation come up a couple months ago. And, in the beginning, when we're first getting started, we're very loose about the boundaries and structure that's there. I mean, there is a framework, but then we do leave certain things open for what happens in the process, and then we talk about it. And so as the need comes up for certain structure to be sort of cemented or reinforced or whatever, then those become things that are part of the therapeutic process.
Okay.
Thank you. Thanks for your question.
Yeah, no problem. Thanks.
Yep. All right, let's see. Just going down the list with all these names shifting around. All right, how about, let's see, Chris. Chris, you have your hand raised. Wait, the buttons keep moving on me. All right, talking permitted. Chris, can you hear me?
Hey, Dr. Greg, can you hear me?
There we are. Hey there.
I got a question for you. What would, can you describe maybe what a typical program would look like, what it might lay out versus a traditional therapy? Is it something where the interaction with the therapist or the coach?
Meaning like the content of what's actually talked about, or how do you mean?
Typically, what's the interaction? So like if I was having a therapy session with yourself or somebody else, I imagine it'd be like 50 minutes every other week or every week. So this would be something that would be more iterative. Is that right?
Yeah, it's something that definitely sort of shifts along the way, and it's really, again, it's very open to what the person needs in that place. So it's very different. Like everybody gets into integrated life. So at the very least, everybody has material to work on in terms of like the virtual retreat or courses or different things like that. But that's really not even what the program is about. It opens up to whatever you're bringing to the table. And so, people typically know what they want to change. That's part of that sort of like motivation for change kind of thing. And like whatever it is that you want to work on, then we're going to talk about like, okay, this is going to be the best way after I spend a little bit of time getting to know you, which might be the first 3 days, that we're going back and forth, just kind of getting to know each other. There's like a pretty in-depth questionnaire. We can use other assessments if we need to kind of dig open some other things. And then we develop a basic conceptualization of what we really want to do to move the needle for you in your life.
So it sounds like it's very customized. It isn't like a boilerplate or a one size fits all.
Absolutely. Yeah. It's totally customized.
Okay. Thank you.
Yep. Sure thing. God bless you.
God bless you.
All right, let's see. Angelina, are you there? Angelina, can you hear me?
I can hear you. I was just typing you a question, actually.
Wonderful.
I am wondering, I am in a master's program for social work, and I'm on the board of directors for a local Ignatian spiritual exercises. I'm not a spiritual director, though. I am wondering in my future if your model of mentoring could be learned as a practitioner and then applied within a separate state. So I realize that this is probably a pretty specific question, but I'm wondering if you've given some thought to taking on additional therapists just to learn the model so that they can apply it separately from CPI.
Yeah, it's definitely part of our plan. On the mentorship page where the application is, there's an FAQ section, and in there's a question of forget how we worded it, but are you training what about other mental health therapists or other professionals who want to learn this model? And if you open that up, there's a link to a form to put down your information for to stay up to date with us. So we do have a list for professionals to keep in touch with. So, once we really kind of develop this internally and really get a handle on training our own people, then that's definitely going to be the next phase to offer a kind of training or credentialing or something to be able to do this outside of CPI.
Okay, thank you.
All right, sure thing. God bless you. All right, Gemma. Gemma, are you there? Gemma, if you can hear me, you got to unmute yourself. All right, maybe we'll come back to you, Gemma. How about, let's see. How about Abby? Abby, can you hear me? Can people hear me right now? Hope it's not my problem. Okay, great. Let's see. I can see the chat right now. So if you've got a burning question and you're ready to hit your mute button. Okay, Vanessa, let me find you. This is such a big list of people with hands up. Not sure how to get to you really quickly. Vanessa, all right. Vanessa Brenner, allowed to talk. Go for it.
Good night, Dr. Greg.
Hey there.
Hi, I'm from Lima, Peru.
Welcome. Thanks for chiming in right now.
Yeah, I have been, looking your website, the emails, and all your work is amazing. But I can't do this mentorship right now, but I will want to do it someday. And I just want you to recommend something that is so value for your job. I think it's like I was thinking to say that by I'm a Catholic and a person, so I think it's like Holy Spirit wants you to stay. So I can recommend you that you can bring us this kind of mentorship, like leader groups or leader information step by step, so a lot of people can benefit with your job that is amazing, and it's a special gift that you have to join psychology and also our faith is something that I am trying to do right now in my job. I'm working as a family orienter or like a counselor in your country. So with family, with kids, with whatever, ladies. So um, I have been in a lot of retreats in my whole life. So I I I think all the people who are here right now are just um, like uh, thinking a lot of things what you when you were speaking about your job, you want to share all the to convince all of us to do your mentorship. But right now I'm doing like a little course, post-grad course about couple and family therapy. And I'm a 40 woman years old, so and I want to live someday in United States, and I want to work there. So
Oh,
because
thank that's really awesome to I think definitely, like I said, to in regards to the last comment about professional development and sort of that's definitely a major interest in bringing something like this out. So we've got plans mapped out to publish a professional journal and to do research on this model. I mean, we're really basically, opening things up right from scratch, like really fresh. And so there's a lot of developing left. And so we've started doing groups with this. We've started to, even within the mentees that I have, the clients that I'm working with, some of them we've put together into little groups. So we actually are doing like some group therapy work. And so there's lots of opportunities, and definitely keep in touch. Fill out that at the FAQ page at CatholicPsych.com/mentorship. And there's going to be some, we'll just keep in touch with whatever.
yeah, I read the masculine genius, the feminine genius, and it helped me a lot. And I'm interested a lot with to give more information about the real psychological stuff, human, but unite with our faith, So I'm not my first language is not English, but I think I have a lot of experience with my career, so I want to have the honor to be participating with your CPI.
Thank you so much. Yeah, definitely. Please keep in touch, and we'll definitely be putting out a lot more. So thanks for coming in, and thanks for sharing. God bless you. All right, who else has got a question? Or let's see. Let me scroll up a little bit. The communication. People are asking about the communication. We have an app that is very unique to. I don't know a lot of people who use it. Some people use it in different sort of like coaching capacities or other sort of like more business type things. It's called Voxer, and it allows for a direct, personal, and private end-to-end encrypted channel for communication. And so it's on your phone. It's always available. And that's that's basically how we do it. Once you get into it, we teach you how to where to download, what you need, and we show you exactly how to use the app. We show you how to we give you the expectations for who you're working with and what you're working on, and we take care of all that stuff for you. So the sort of clunkiness and awkwardness and some of that anticipation of like actually working with somebody, a lot of that stuff we're very aware of. That's a normal part of therapy. And even in my psychotherapy practice, you know, we really do try to lessen that angst, you know, out of that understanding of our position. All right. It's not texting, it's voice, it's recorded voice. So it's not texting. There's texting that does happen on the app. You could text or send pictures or videos or things like that. But the majority of the work that we do that we find is really effective is recorded voice. So again, it's not live. It's because that allows for the space for really deep reflection and prayer and discernment, and it opens up a lot more deeper channels of understanding within that channel of communication. When face-to-face mentoring relationship is not possible due to distance, how do you operate? That's what I'm saying. We're doing it all by voice. It's voice recorded. So this is one way that we've pivoted and sort of overcome the challenges of what COVID 2020 decided to throw at us. And then in doing that, we completely stumbled into something that works so much more, something incredibly helpful. Guillermo, welcome. It's a good question if it adds in other things. The amazing thing is that when I first started this, I was again very nervous about switching over to this modality. And so I told all the clients I was working with, like, if you want to schedule an appointment to still meet face to face, not meet, but on Zoom or whatever, then I'm happy to. Like, I wasn't trying to cut that out. I was trying to think of something better. And so if it was adding to it, then we would totally do that. So what ended up happening is, like, okay, you schedule your appointment, it's Friday or Thursday, and you want to, schedule an appointment. Okay, well, I have a spot, next Wednesday, next Thursday, and we'll meet then. And the next thing you know, you're talking on Monday, back and forth, Tuesday, Wednesday, Thursday. By the time you get to your scheduled appointment, you're like, I don't need to talk about this anymore. What was the point of that? So we realized, like, this is actually more effective. It works. And the thing that you think you're losing from not having that real-time personal dimension, by the way, we acknowledge completely that we're actually missing something. It's not the same kind of relationship. But the point is it effective for the goal that you set out for when you signed up for therapy or when you signed up for whatever you're signing up for? That's the important goal. Even when we switched to remote therapy, I was one of the first people to ever do that, even way before COVID. And people are like, it's not the same. You're not in the room. I know it's not the same. But the point is, does it have to be the same to achieve the goal that you signed up for? And the answer is a very loud and resounding no. It doesn't have to be the same. And again, you can have personal relationships that are not in real time at all through letter writing. You can have much deeper, more intimate communication, writing a letter to somebody or receiving a letter from somebody. So, this model is definitely challenging our assumptions, our expectations, our conceptualization of what this is all about, which is, again, why I'm inviting people to try it and, not lose anything. It's risk-free if it doesn't work for you, if you don't believe me. But that's what we're inviting people to and announcing here. All right, Vanessa, I saw you put your hand up. I'm going to hit you allow to talk. No, not Vanessa. Wait, that was the wrong button. Sorry, Vanessa, you put your hand up before. We already heard from you. Sorry, guys, it's getting late. And My eyes are getting a little foggy. All right, Inez, let me find you. There you are. Wait, there you went. Inez, allowed to talk.
Hi, can you hear me?
Yes.
How are you, Dr. Greg?
Good, thanks. How are you?
Thanks. Good, thank you. Look, I'm not sure if you've seen the comments on the chat. I'm the one calling from Australia, so just a quick question in regards to payment.
Sure.
Look, for some of us, that's, we've been hanging to the end because that's the main factor, to make a decision. Is there any plan to offer some sort of repayment plan, or because you did say at the beginning of your talk that one of the things that was broken in the system was the fact that a lot of people can't afford quality therapy, and yet we get to the end of this talk, and for a lot of us that were listening, I'm sure looking at the comments, we won't be able to afford the $9.97 a month. So anyway, just before I leave, just wanted to ask if there's any plans of.
Yeah, absolutely. We definitely have it built in to offer, and it's a great question, and it's a legitimate concern, and that's why, it's really an important, thing to really kind of think through, like when we say can't afford, what we actually mean by that. And there's a lot of people that actually can't afford whatever it is that's being offered or the help that's there or whatever. And so, like I said, also, I've never actually turned people away who were showing up. Remember the 3 circles. And if people bring to the encounter the motivation to change and that real commitment to the work, and they actually just don't have the finances, then 100% we find a way to make it work. I'm working with somebody that somebody sent to me. There's not going to give away any identifying details, but there's a famous Catholic sort of celebrity speaker who sent me an email when I was first getting started, and he wanted to take care of somebody's therapy. And I was like, okay, let's see what this is like. Long story short, turns out that this was a person in a third world country who literally had no money. And in fact, she was so severely crippled by her trauma that she was locked in her room for, and this is true, 8 years. She stayed inside of her room. And the only thing that she did to reach out to the world was to watch YouTube videos. And so she was in this conversion, coming around to being Catholic, and she had reached out to this Catholic speaker watching his YouTube videos. And so he wrote to me, he's like, is there anything you can do? And he's like, I'll take care of her and let's do this. So long story short, 3 years into the work with her, the speaker was like, hey, listen, what's going on here in this work? Like, is this, I know I signed up to help out, but like, what are we actually, signing up for here? And then eventually he went through some difficulties of his own, and he had to back away from doing that. And now I've been working with this person for 4 years, and I knew very well her actual commitment to do the change and make the changes and go through this work. And so, now it's 8 years later and haven't charged her a penny. So these are the kinds of things that it's not just about the money. It's about showing up and valuing things correctly. So there's a lot of people who will take out a loan to go to school, or will spend a certain amount of money on XYZ, whatever it is, your monthly bills or your annual costs for certain things or whatever. And so it's just a really important thing. Like, we're not taking advantage of people by any means. We're providing something almost at the same cost of regular therapy. In fact, there's a lot, $997 actually turns into averaged out about $230 a week. In Manhattan, a therapist costs $400 a week. So, and that's average. Like, that's not the same as Kansas or Nebraska. But the point is, it's almost the same as an average for a weekly therapy cost. And we're giving you 4 times the amount of access of regular therapy. And that means that our therapists have to make themselves available 4 times as much than regular psychotherapy. So it's not an unfair money issue. And like I said, if you have real need and you're showing up with real commitment and real desire to make the change, then we will make the accommodations. Guillermo says, are you paying 3 months of mentorship over the course of the year? No, it's just 1 month at a time. You don't have to do it for 3 months. It's just 1 month at a time. You sign up for 3 months and pay the sum total. It's monthly. You have to pay monthly. That's how it's structured right now. Somebody else said, like, we're just getting started here. We're just getting started here, guys. Like, this whole thing is about announcing this new thing. The pricing model can definitely change, but we're just trying to change the field of mental health. That's all. All right, let me see. Who else has got questions? We still have a lot of hands raised. Here, this is what I'm going to do. I'm going to lower all the hands because I don't know who has a hand left up from before. So I'm going to lower all the hands, and then I'm going to answer people who raise their hand again if you've got something that okay, wait, Eileen, wait. Oh, now it's too fast. All right. Eileen, you were the first one. Go ahead, Eileen.
Yes, what I wanted to say is it sounds wonderful, and it is, and you're right, it is getting late. Where can we get the application?
CatholicPsych.com/mentorship.
Oh, okay.
Let me see if I can pin that. I don't know if I can pin to the chat here. Hold on. I'm sorry if that didn't come through for you before. You've been waiting this whole time for that. I mentioned that a little while ago, but let me see if I can't pin it. All right. Anyways, I'm gonna pick somebody else here.
Oh, I think I see it.
Okay, there you go. Let me move this over here.
Oh, there it is.
All right, Ann Spencer.
Hello.
Hey there.
Right.
Hey, Ann.
I was just wondering, some of us may know people that need specific help. How do we summarize this good call for them and then send them there? We can't all just send them to the website.
Yeah, so with that, I'm gonna make the video available. So there's gonna be a replay video available, and you can send people to the replay.
Great.
It'll be at CatholicPsych.com. Actually, the same link that you signed up for to register will be the same link to register for the replay.
Okay, great.
Thank you. God bless you.
God bless you.
All right, let's see who else wants to. Nancy, I don't think we've gotten to you yet. Hold on. Allow to talk, Nancy.
Hi. This is just kind of weird. Can you hear me?
Hey there. Yep, loud and clear.
Yeah, I don't know. I feel like there's a lot of people, so I almost feel like I'm on The Price is Right. Like, ooh.
It's just me and you. Just think about it being like me and you.
Okay, well, so here's the thing. I was a patient with Catholic Psych for about 2 years, and I had to cut everything kind of right when COVID started because of financial reasons. And so everything's kind of back and running in my life, and I wanted to jump back in to kind of close out on some like loose ends that I felt like I never got to. And I don't know if it's very common in therapy, but like I'm a talker, and I always feel like at the end of the 45 minutes, it's like, oh, I didn't get through everything I wanted to talk about.
Yeah.
And
exactly.
It's like, is that pretty common that it kind of gets stretched out to 2 years that you still don't get to in this model?
That's exactly what's common. That's the whole point. It's like, or you're saying in mentorship or in the old model?
In the old model.
Yeah. So that's what ends up happening is like that, because you're forced into that box. Like some people are really good at the way they think and organizing and like coming in, and it's like, okay, boom, 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 and they can do it. But unfortunately, and if you get into the brain science, the way that we compartmentalize and structure around communication is deeply tied into a lot of other mental health issues. So learning how to formulate thoughts and verbalize them is like a really important part of the therapeutic process. And in the 45 minutes once a week, sometimes it's just too far to sort of ease into that. So we work with this, and I've had a number of patients actually over the last year where we talk about this very thing. And we work on structuring the conversation and the communication that's happening on the daily basis. But it's like, you know, I started off and I had people just kind of go on and like give me a slew of just sort of like tidbits of details that honestly are pretty inconsequential. Mm-hmm. And then if the most important thing about it is the fact that that's how their mind is working. And that gives me a huge window into like, okay, this is something I can really help you with. Like, let's talk about that. Let's talk about how we talk, how we think, because that affects everything else about how we feel. So that's one part of the old model that it was very limited in the way that you could actually do that in real time in 45 minutes. Whereas now it's really slowed down and spread out. So I would definitely recommend getting back in touch. And if you are working with somebody before, you can either shoot me an email directly or email the person that you were working with before.
Now, is the $9.97, is that like just a limited time rate? Is that like a small window of time that we have to fill out the application for that to be so? Or
yeah, so that's what we're offering for this month and potentially for next month. I'm not sure. It really depends on a lot of different factors. We have a lot of people calling in and filling up our spots. So it's going to depend on who I have to hire, train, who has availability. There's like a number of moving pieces to this, but if there's a spot available for getting started for this next month, that'll be the price for it.
Okay, sounds good.
All right, thanks so much.
All right, thank you.
God bless you.
You too.
All right, I had a couple of questions here. I see people asking about marriage work on this. So this is the coolest thing about it. And I didn't start off thinking about this, but then when I started training my team, they brought this to the table, and they're amazing. And they started practicing and experimenting with this. But because so much of the marriage work that we do is precisely training in communication, then the channels that open up when you're splitting out how to talk from both sides, how to speak and really express at the heart level what really needs to be said, not just firing back defensive comments and defending yourself and attacking the other person without meaning to and but like really meaningful, deep, heartfelt expression, and then really meaningful, deep, and heartfelt empathy and understanding and listening with tenderness. And we can actually force that model with this modality. And somebody asked if it's $9.97 times 2. No. So if you come to work as a couple, if you're working on a marriage issue, then you're working with one person and you're using that one person's time. It's just considered one, client. We work on the marriage. That's our client. And so it's still just $9.97 times 1. All right. Tyler says, are there other current DMU students on here? Oh, you're just asking if anybody else. Hey, all you students, by the way, I just started, if you don't know already, I started a Facebook group. I just really want to give back to mental health students, graduate students. So if you're in a graduate student program for mental health, Catholic or not, the program doesn't have to be Catholic, but look me up on Facebook or shoot me a message and I'll invite you into our group. Danielle, we are eventually going to be hiring sooner than later, maybe depending on how many people want to sign up for this. But there's a form on the FAQ on the mentorship page. Go to CatholicPsych.com/mentorship. And then under the FAQ, look for the question about professionals being trained, and then fill out the form there to give us your info, and we'll be in touch. Angelina, absolutely. It's my pleasure. All right. I can pick on a few more people with raised hands here. Monica, are you still with us? Monica, are you there? All right, Monica, come back to us if you're with us. I'm going to lower that, and then you can raise
you
your
hear
hand.
me?
Oh, there you are. You are.
Oh,
You figured it out.
sorry.
Good.
I was trying to figure it out. First of all, I just wanted to say thank you. And I think this model is going to help a lot of people. I can already see how it could be very beneficial. I was just curious about if we fill out the application and we're not accepted into this round, would we get a chance to be accepted into later on, or how would that work?
Yeah, it really depends. Well, what I'll do is, and I list this on the application page, but I'll follow up with you if there's a reason why we have a question. It's most likely it's more of a screening. So like if I have a question, I'll follow up with a question to kind of dig a little bit further into something if I see something. But otherwise, and it depends on what opens up. But if there was a reason why I didn't think that this is a good fit, I'd either make a referral, or we'd kind of go a little deeper to kind of talk it out to figure out what might work or might not work if we want to give it a shot anyway. But it's a little bit of a process too. And there's a little bit more than that too. Once you're invited, then, we do have like a really deep dive questionnaire that will really open up a lot of different things as well. But it's more for us to like protect you as well as making sure that it's a good fit for us.
Okay. Thank you very much.
All right. You're welcome. God bless you.
God bless you.
Thanks. All right, Rose. Rose, can you hear me? If anybody else wanted to ask any questions, you could raise your hand. A lot of people staying up with me tonight. All right, I'm not sure if Rose is coming around, so I'll come back to you, Rose. I'll try again.
Unmute. Okay, I got it. Hey.
Oh, just in the nick of time.
It just popped up. My internet's very bad. One of the things I wanted to mention, okay, I'm an old lady. Didn't expect to live this long. Your comment about the prices. I'm in California. My therapist charges almost $500 for a 45-minute, but I'm on Medicare and I have a Medigap, so I pay $0. I can afford your $997. I just am unsure of, well, you went on a long time talking about value, and I totally understand the value, but I think a lot of us would have appreciated, especially people my age, where time is very limited because we don't know if we have 2 more minutes or 2 more years. So just as a fact to you, I think you're awesome, but don't hem around the bush so much. And I do have a friend who is just gone into psychotherapy in mental health, women's health. And she is really awesome. And she always tries to put God in her thing, even though she works for a large medical firm. So I'm going to definitely have her listen to your video, because I think she might be very, very interested. She's been in the justice system. She's been through working with alcoholics and drug addicts, and she is bilingual. So she's really awesome, and I think she'd be great working with your group.
Oh, amazing. Thank you so much. Please send her our way, and yeah, have her check out the video. And I really appreciate your feedback and being with us tonight. And please keep me in your prayers.
I will, and keep me on your list because I did send in my application.
Wonderful. Thank you so much. God bless you.
God bless you. Thank you. Bye-bye.
Bye. All right, Matt, you put up your hand. Hold on a sec. All right, go for it.
Hey, how you doing?
Good, thanks. How are you?
Good. Yeah, I think you answered this already, but I just kind of wanted to maybe ask again. So I'm a marriage and family therapist associate in California. Are you looking? So would I just go to the same page just to be, if I was interested in like doing the training and stuff?
Yeah.
Are
So
you
go to the mentorship page, and then under the FAQ, there's a question that says something like, "Are you training other professionals?" And then there's a link to our form there for professionals to fill out if you want to keep in touch and get information. So we're rolling out. I mean, right now we're training internally. And we're definitely going to be likely hiring for this particularly. And the neat thing about this is it's a separate business basically. So you could technically do both things. All of us are doing both things. So that's kind of the plan. And then down the road, we'll also be in touch about, we do have a plan to really make this professional. We're going to develop a professional journal, start doing better research, more research on it, and then offer some kind of training or certification or something like that. So definitely keep in touch.
Cool. All right. Thank you.
Sure thing. You're welcome. God bless you.
God bless. Thanks.
All right. Anybody else have any questions with a raised hand? Nancy says it sounds a little ambitious. It's really, really intense. It's really, it's for people that really want to work on stuff. There's a lot of people and I'm not saying this for everybody, but there are a lot of people that do show up to therapy kind of just, making their way through. They kind of show up sometimes for somebody else's sake. And, it's just like the thing you do, you check it off your list. You go to your, get your Starbucks. Maybe you go to your, exercise class. You go to, therapy on Thursday afternoon. And it's just like part of what you do. But if there's a real fire to like really work on something, like you want to go all in on it. And so it's intense. It's not ambitious because it is intense. And that intensity changes everything. The frequency of dialogue. Thank you, Joanna. Joanna is an assistant who is like an angel, a guardian angel, just watching over my shoulder. And she gave a link here for Matt and any other professional people who are interested, mental health professionals who want to learn more about training or opportunities or keeping in touch with us along the way. That link there is at the bottom of the chat. It is CatholicPsych.com/professional-interest. We should probably shorten that URL. That's a mouthful. All right. And thank you for who made the comment? Angelina, reminding me that it's actually only 7 p.m. on the West Coast. We're running on 10:30 here on the East Coast. So if you're East Coast people staying up with me, like my faithful assistants and I think I probably have a few fellow therapists on here. Thank you. Mike, does Catholic Psych employ psychiatrists? At this time, we do not. We love to refer to psychiatrists. We have a few in the area that we work very closely with, but don't have the model for employing any yet. Thank you, John. Thank you for your prayers. And yes, that's really everything. Help, yes, I need those prayers to be the best husband and dad. That's really everything. Awesome. Thanks, Tyler. All right, let's see. Jiao, is that how you pronounce your name? Jiao?
Hey, Dr. Greg, is Joel from
Joao.
Portugal. I'd like to ask you about, I think I sent you an email a while ago, and when I first heard about the town hall, it would be something similar that I heard from Dr. Dilsaver, the founder of Imago Dei Psychotherapy, and something called psychomoralytics that he turned it into. Did you hear about that? It felt
I do. I recall your email and mentioning that. I have never heard of that before.
So he a few years ago, he felt pretty much along the same lines if you look him up. But it seems I actually inquired with him a while ago, and they actually studied something similar to you. So we're kind of feeling all the same thing. By the way, I'm finishing a master's in clinical psychology here, probably going to the United States as soon as I get my visa. I'm getting married there this year.
Oh, amazing! Congratulations.
Thank you. We're actually just sorting it out recently. So I'm very, to tell you a bit of a story really fast. I've always been very disappointed with the secular way of handling things, not just because it's secular, but just because I thought people deserved better. And I think I was, with the Catholic background and all of my, maybe my understanding of what it could be to be, to have a good life in this world. I felt that therapy offered so little. Not to go into details right now, but I think we kind of all have that feeling when we get these, and I think you touched on all the right points today. So I'm really interested in this model, and also looked about Dilsaver. But the thing that I think again, you really reached a point where you could like sort of maximize the impact that you can have with this, and bring on board professionals that are going to make sure they have a smooth transition with their client, with their, how many people they have available to work with. So, yeah, I'm just kind of wondering about the comparison there. So I was also wondering about the young therapists or people who are still in school, because I haven't been able to find it. I sent you a message through my fiance's cell phone because I couldn't access you through the phone.
Oh,
when you
yes,
asked
that's
for it.
right. Did you get access to that group?
I'm not sure. I didn't get like a direct link. So I'm still trying to find the group on Facebook.
Huh.
I'm not exactly sure how to find it. Maybe I haven't looked enough with the name. Does it have a name that you remember?
It is Catholic mental health graduate students, I believe. I don't know.
Okay.
Amy Grace, do you have any idea? Can you pull up a link?
Someone knows the link. Share in the chat.
Amy Grace, if you can pull up the link for the Facebook group. This is for graduate students of mental health. So not for everybody, but if that is, I know we have still about 100 people here, so I don't want everybody trying to sign up for the Facebook group. But if you're a graduate mental health student, please join our group. It's a special group specifically for that, and so we can talk about these issues as it relates to the education and formation of our professional identities, trying to work in this world as a Catholic. And so whether it's through a particular model or just in a hospital or anywhere else, it doesn't really matter. We all have some calling to work in this field in a particular way. So yeah, Joao, go ahead and look for that. Amy Grace will post the link, and then you can go ahead and sign up there.
All right. Thank you.
God bless you. Thanks.
Some point. I'll perfect.
All right. Any other questions? I'll stay with you guys all night long if you want. So keep asking questions and I'll answer all of them. Anybody else have any other questions? All right. Well, here's another thing. Why don't you put in, if anybody's still chatting here, a prayer intention, because I'm going to end us up with some prayer. This is how we end every Thursday night live when we do our integrated live call. And Mike's yelling, wait. Okay, Mike. Everybody else, think about an intention you want to pray for right now as we're getting ready to wrap up in prayer. And you can throw it in the chat. Mike, did you have a question? Opinions in how psychology is used in canon law tribunals. You're going to have to send me an email about that one. We've done a lot of work with canon lawyers, with tribunals, with a lot of different stuff. It's messy and it's necessary. You know, that's what I've learned. And, you know, even dealing with the civil law in the interaction between the two, ultimately it is God's work. And, you know, it's a pretty tough spot to be in. So I'm going to keep you in prayer, and you can shoot me an email if you want more. Oh, hey, Samantha. Pray for me, pray for my wife, pray for our number 6. Our baby's name is Petra Benedicta. And so you can pray for Petra and a healthy and safe delivery and calm and peace in the house. We have 5 kids under 8 who are going to be welcoming little Petra Benedicta into the world. So keep our family in your prayers, please. And then obviously all of this great work that God has set us up for. All right. For suffering from COVID, for relief, for dad with severe chronic pain, for Catherine's studies and future professional life, for Danielle's students and staff. All right. For Gerard and Charlotte, first great-great-grandchild of Rose. Oh, beautiful. Oh, beautiful, Rose. You're very welcome, Louis. I pray for all people with mental health difficulties. Absolutely. Especially through the intercession of St. Dymphna. And I like to pray to St. Augustine for that. For all priests and religious, offer up all these intentions. In the name of the Father, Son, and the Holy Spirit, amen. Heavenly Father, we place all of these intentions in your hands through the intercession and the purifying love and perfection of Our Lady. Hail Mary, full of grace, the Lord is with thee. Blessed art thou among women, and blessed is the fruit of thy womb, Jesus. Holy Mary, Mother of God, pray for us sinners now and at the hour of our death. Amen. Most Sacred Heart of Jesus, have mercy on us. In the name of the Father, Son, and the Holy Spirit. Amen. Awesome. Thank you all so much, everybody, for joining, and love to talk to you soon again. God bless you.